We were founded over 30 years ago by 6 Latino physicians who grew up in LA and really wanted to come back to their community to create a group of physicians that this community needed. The 6 of them started our group practice as well as our family medicine residency program.
I came here as a resident and I had done a rotation as a medical student. And I think everybody working towards the same mission, caring for this community has always been something that really continues to motivate me to stay here these last 20 or so years.
One of the things that drew me to this particular program was just the heavy emphasis and involvement within the community.
Especially being in East Los Angeles, Boyle Heights. A lot of the patients we see here are a reflection of our community, and I feel like that helps us grow closer with our patients.
We really are working in a world-class hospital, different technologies. We have great specialists in a lot of different areas.
It can be a little scary as an intern starting, but I definitely felt very welcomed.
In the beginning of their intern year, they have a full month of orientation. They have experiences in the community where they learn firsthand what resources are available, and that orientation sets our residents up for success.
We are a program, one of the family medicine programs that focuses a little bit more on inpatient training than other programs.
We do spend a lot of time in the hospital, but I feel like that's where I found the most joy, is because you get that time to talk to the patients, you get that time to talk to their family members.
Usually 4 months of inpatient medicine, 2 months of OB, and there's inpatient peds and surgery.
We really need to care for patients who have complex medical problems, kidney disease, heart disease, diabetes, all those different complicating factors. Having that inpatient training makes you a really great outpatient doctor.
It's really a team dynamic. You're able to call upon your ancillary staff, including the case managers, the social workers.
They get to talk to specialists in real time, go down and look at scans with the radiologist. They may get to do some procedures.
Throughout your first year, you're really going to see your progress. You'll see those milestones as time goes by.
When you get to your third year, it will be mostly clinic.
We really get to connect with our patients. We get to follow up with them just across the street at the clinic.
When we see patients in the clinic, we're taking experiences that we've had from the inpatient setting.
If you want to see different diagnoses every single day, learn multiple management plans, this is the program you want to be at.
We really try to prepare our residents for anything that they want to do. We don't want to limit our residents.
You learn so much your first year. That's why it's really important you have a supportive team, supportive attendings.
I definitely feel a part of a family.
Our faculty love working with our residents because they challenge us, they inspire us, and they have a deep understanding that they need to take care of themselves before they can take care of other people.
To me, the most important parts of wellness are really feeling connected with other people. And I think the community we create with residents, with faculty, I think that supportive social network is really, really important.
To kind of help them navigate, we have a Big Sib, Little Sib program. Residents are paired with an advisor.
We also have a gym here on campus which focuses on general overall health.
We have Sync Talk, which is a resource that's available for mental health, and our behavioral health specialist runs our wellness committee. So it's been really great to have.
When you talk about wellness, it's not just about having social activities or life outside of residency. I think that's important, but I think just as important is to come to work feeling like you have a purpose, that you are able to do something with your knowledge to help someone else.
With family medicine, we can really maintain the continuity of care. We aren't just putting a Band-Aid on problems, but we're really able to see them in the hospital, take care of them in our clinic, and really provide, I think, the more holistic care.
I grew up just 20 minutes outside of this community, so it's been really special to be able to be a part of taking care of this vulnerable population.
We've been here for more than 30 years, so there's really just a lot of ways in which we try to connect with the community, working with different elementary schools, high schools. We go to homeless shelters, we work with Homeboy Industries.
The core of who we are is to train and develop future family physicians to become advocates and leaders.
With everything you learn, every patient you see, it empowers you more.
The beauty of family medicine is that we are actively searching and trying to improve our environment and the community around us.